Every single day, billions of people around the world reach for the same little white tablet, paracetamol. You probably have it in your home right now. You have taken it for headaches, for fever, for pain after a long day. It feels safe. It looks harmless. It is sold without a prescription in almost every country on earth. But here is a fact that most people do not know. Paracetamol is the #1 cause of acute liver failure in the United States, the United Kingdom, and Australia. Not from one massive overdose, sometimes from just slightly too much for slightly too long. So today on Med Logos, we are going to look at exactly how this drug works at the molecular level and why something so common can be so dangerous. First, let us get the name straight. Depending on where you live in the world, you may know this drug by a different name: paracetamol, acetaminophen, Panadol, Tylenol, Calpol. They are the exact same molecule, the same drug, just different names in different countries. Paracetamol was first developed in the 1800s, but it became widely used as a medicine in the 1950s. For 70 years, it has been one of the most prescribed and purchased drugs in human history. It belongs to a class of drugs called analgesics, meaning painkillers, and it also works as an antipyretic, meaning it reduces fever. But unlike ibuprofen or aspirin, paracetamol is not an anti-inflammatory. It does not reduce swelling, and that distinction is connected to how it actually works in the body, which we will get to very soon. So, how does paracetamol actually stop pain? This is where it gets interesting. When your body is injured or inflamed, your cells produce chemicals called prostaglandins. Think of prostaglandins as your body's alarm signal. They amplify pain, cause fever, and trigger inflammation. To make prostaglandins, your body uses an enzyme called COX, cyclooxygenase. It is like a factory that manufactures the alarm signal. Drugs like ibuprofen and aspirin block the COX enzyme throughout the entire body, in your joints, your stomach, your blood vessels. That is why they reduce inflammation and thin the blood and can damage the stomach lining. But paracetamol works differently. Scientists believe it works primarily in the brain and spinal cord, not in the rest of the body. It inhibits a specific version of the COX enzyme found in the central nervous system. This raises your pain threshold, meaning your brain stops receiving the pain signal as strongly. And it resets your body's temperature control center in the hypothalamus, bringing down your fever. This is actually why paracetamol does not reduce inflammation at the site of injury. It is not blocking COX in your tissues. It is working upstream, in your brain itself. Now, what happens after paracetamol enters your body? It is absorbed quickly from your small intestine. Within 30 to 60 minutes, it reaches its peak concentration in your bloodstream. You feel the pain relief beginning around 30 minutes, maximum effect at about 1 hour. Then it travels to your liver, and this is where the story takes a darker turn. Your liver is responsible for metabolizing, breaking down, almost every drug you take. And for paracetamol, this is where the danger lives. When paracetamol reaches your liver, it gets broken down through 3 different pathways. The first 2 pathways are safe. They convert the drug into harmless byproducts that your kidneys excrete in urine. But there is a third pathway. A small percentage of paracetamol is converted by a liver enzyme called CYP2E1 into a highly toxic molecule. Its name is NAPQI. NAPQI is a poison. It directly destroys liver cells by binding to their proteins and causing them to die. But your liver has a defense system. A powerful antioxidant called glutathione immediately neutralizes NAPQI, converting it into a harmless compound. Here is the critical point. At normal doses, your liver produces NAPQI safely and neutralizes it with glutathione. No damage occurs. But when you take too much paracetamol, your glutathione stores become exhausted. NAPQI is no longer neutralized, and it begins destroying your liver cells, causing acute liver failure. This damage can be irreversible. Liver transplants have been needed in severe cases of paracetamol overdose. Overdose, particularly dangerous, is that it is almost completely silent in the first 24 hours. In the first 24 hours, there are no symptoms. You feel completely fine. But your liver is being damaged silently. Between 24 and 72 hours, nausea, vomiting, and stomach pain begin. Liver enzymes are rising. Past 72 hours, liver failure can occur. This becomes a medical emergency. By the time a person feels sick, significant liver damage has already occurred. This is why paracetamol overdose is so dangerous. People often do not seek help in time. And here is a fact that surprises many people. You do not have to take a massive amount to cause harm in certain situations. Heavy alcohol drinkers are at much higher risk. Alcohol induces CYEIP2E1, producing more NAPQI than normal. People who are malnourished or fasting have lower glutathione reserves. They have less protection. People taking other medications that use the same liver pathway may also produce more NAPQI. This is why reading the label and staying within the recommended dose is not just advice. It is protection for your liver. So now that you understand exactly how paracetamol works and why it can be dangerous, let me give you the clear, science-backed rules to use it safely. Rule 1. For adults, the maximum single dose is 1 gram. That is typically 2 standard 500 milligram tablets. Rule 2. The maximum you should take in one day is 4 grams. But if you drink alcohol regularly, that limit drops to 3 grams per day. This is because alcohol depletes your glutathione stores. Rule 3. Always leave at least 4 to 6 hours between doses. Taking doses too close together is one of the most common ways people accidentally harm their livers. Rule 4. And this one surprises many people. Paracetamol is hidden inside hundreds of combination medications, cold and flu syrups, prescription pain medications, headache powders. If you are taking 2 different products and both contain paracetamol, you are doubling your dose without knowing it. Always read the ingredients list of every medicine you take at the same time. Look for paracetamol, acetaminophen, or APAP. And Rule 5. If you or someone you know has taken too much paracetamol, even if they feel completely normal, go to an emergency room immediately. The antidote, called N-acetyl-cysteine, works best when given within the first few hours. Do not wait for symptoms. One of the most common questions people ask is, should I take paracetamol or ibuprofen? The answer depends on what you are treating. Choose paracetamol for headaches, fever, and general aches. It is preferred if you have a sensitive stomach because, unlike ibuprofen, it does not irritate the stomach lining. It is also the safer option during pregnancy. Choose ibuprofen when inflammation is the main issue, muscle strain, arthritis, dental pain, or injuries with swelling. Because ibuprofen actively reduces inflammation at the site of injury, it is more effective for these conditions. However, avoid ibuprofen if you have kidney problems, a history of stomach ulcers, or if you are taking blood thinners. Both drugs can be used safely when used correctly. Know what you are treating, then choose the right tool. Let us bring everything together. First, paracetamol works in your brain and spinal cord, not at the site of pain. That is why it relieves pain, but does not reduce swelling. Second, your liver processes it into a toxic molecule, NAPQI. At normal doses, your liver neutralizes this safely. At high doses, your liver cannot keep up. Third, paracetamol overdose is dangerous precisely because it is symptom-free at first. By the time you feel sick, serious damage has already occurred. And fourth, always stay within the recommended dose. Space your doses correctly and check every medication you take for hidden paracetamol. Your medications are powerful tools, and like any powerful tool, they work best when you understand them. That is exactly why MedLogos exists, to give you the real science behind the medicines you take every day in plain, simple language. If this video helped you understand paracetamol better, share it with one person you care about, because this information could genuinely protect someone's liver. Subscribe to MedLogos so you never miss a video. New content every Tuesday and Friday. I will see you in the next one.